Thank you, everybody. That was way too enthusiastic, but I'll try and live up to some of those expectations. First, I wanted to thank our media post, facilitators, hosts, and the AV team in the back for bringing out the blue or the bright orange orb that hangs in the sky today. So thank you very much for that effort there. I enjoy coming to events like this because, and I know we all have the same kind of machination when we look at our schedules and think, I got a lot going on at home. I got kids, I got commitments, I got ballet practice. I don't know if you take ballet, but it's a commitment to come to something like this. But I always come away energized because I always learn something. And so it's really nice to be in a room with you, to learn from you, to hear what you're experiencing, to kind of commiserate about some of the same things that we share. So I appreciate all of your time and all the conversations I've had because they've been pretty powerful. What I wanted to share with you today is a campaign that we called Stop the Iron Pipeline. I'm going to back up a little bit. So I mentioned events like this because I was at an event sponsored by the AHA, the American Hospital Association. I was presenting with our CIO, and we were talking about the challenges that we face as internal marketers, as an internal IS person, to really bring that patient experience home. And so in that conversation and in preparing for that presentation, I was looking at some World Health Organization data. And the data was really listing out all industrialized countries and the satisfaction their citizens have with the healthcare that they receive in their country. So, spoiler alert, we crush North Korea, so all good news there. But of those top, let's say, 12 countries, where do you think the United States ranks in terms of satisfaction with their healthcare? Any guesses? Right, because I'm asking, right? It's the 12th. We're in the 12th spot. And so the presentation went great. I went back and I talked to my boss, the CEO, and I was surprised by this data. And so we were having a conversation. His background is public health. And so we were talking about why this is. We kind of came to the conclusion that it's really about the fact that our healthcare system is designed still, really, in most cases, fee-for-service, and it's reactive in nature. A lot of those countries that we looked at, Sweden, Singapore, South Korea, Germany, a lot of those, they're high tax, structures, granted, but a lot of what they do for their population is preventive medicine. There's a lot of investment on population health, on factors that drive and support those with chronic disease. And so we started looking at our own region. I am CMO, as Doug mentioned, from a mid to large health system called LifeBridge Health. We have about 15,000 employees, close to 2,000 physicians. But we're in the Mid-Atlantic, we're in Baltimore. And gun violence is particularly acute in our neck of the woods. And there's lots of reasons for that. Primarily, we are the transit point for a lot of firearms coming from the south, going through the north, because you're moving from really more lax gun control regions of the nation to more high control, legislatively mandated controls on firearm sales up in the north. So we thought, how do we get around this issue? And as everyone in the room can probably surmise, it's a very sticky issue. We didn't want it to be a red issue. We didn't want it to be a blue issue. How do we tackle this public health crisis without alienating half the people right out of the gate? So we enlisted our agency, Strawberry Frog. There's somebody in the room from Strawberry Frog today, and they've been great partners of mine. My background actually is consumer goods, consumer finance. I came from Target, Best Buy, Capital One, places like that. And so Strawberry Frog was our agency of record. We put this problem in their lap, and we said, how do we do this? How do we tackle the scourge of gun violence affecting Maryland in particular, Baltimore in particular, but all of Maryland and our region? How do we do this without alienating consumers right out of the gate? And so we found a way in, and it is essentially targeting the iron pipeline. So not targeting gun owners, not targeting those who use the guns in commitment of crimes. And by the way, 2/3 of gun crimes committed in the state of Maryland are with illegally trafficked firearms. So people say to me, well, guns don't kill people, people kill people. That's true, except for the fact, if you took an illegal gun out of the hands of somebody who shouldn't have it in the first place, there's a lot less likelihood for carnage and violence. So we focused on really driving awareness of what's called the iron pipeline, raising awareness of it, but doing so in a way that was unique. It leveraged storytelling. It leveraged a lot of senses. So you think about auditory, you think about visual, you think about text and copy and things like that, truly trying to engage the audience while we're telling them a story. Our creative director at Strawberry Frog calls it the coolest PSA you've ever seen. So with that, how does something like this square up with our mission? So when I got to LifeBridge Health, as a lot of health systems have experienced in the last 10 years, we were an amalgamation of hospitals. We had acquired 5 or 6 in just in the last few years, but each had their own identity, their own culture. So I created the connective tissue, and it's authentic because it's a red thread that runs through all of them. It's called Care Bravely, and it's what we do better than anybody else. It's our reason for existence, is when we see a problem, we don't shy away from it or pivot, we go towards the problem. And that's really what we're about. So this iron pipeline effort or initiative or thought we had squared up very nicely with our Care Bravely motto, our Care Bravely purpose. And really, for a lot of organizations, mission and vision kind of sit on the shelf, and often they're interchanged and people confuse the two. A mission is what you do to get to your end state, which is your vision, right? So to improve the health of the individuals and communities we serve. This effort, which really hadn't been done other than our partners at Northwell, and their call to action was a little bit different than ours because their problems are different than ours, but it fits really nicely into our brand purpose. So guns are the leading cause of death for kids and teens. So I didn't know that as a father of 4 when I started down this path. And that's a frightening statistic. And so it was really kind of the call to action for me, my team, others within the organization, our CEO, to really let's focus our Stop the Iron Pipeline campaign on youth. Youth are often seen as the problem. And we as a society sometimes put our problems on the youth. They don't understand, they don't have the maturity, etc. We wanted to leverage their engagement, leverage their passion, their tenacity in service of this campaign. And so that was job number 1. 81% of homicides by gun, homicides by gun grew 81% over the last decade. 81%. So many of you know the Surgeon General last year called firearm violence, gun violence, a public health crisis. We completely agree. And as a organization, as a group of individuals, as an industry or vertical, whatever you want to call it, that is empirically driven, this is data that should make everybody sit up and take notice. If this were anything else other than guns, we would have a campaign already and a nationwide effort to combat this effort. So take that 81% and that kids and teens are killed at a rate by guns we've never seen before and put it on a chart, and that's the red line. So when we all grew up, at least maybe when I grew up, my kids would say, Dad, did you ride a horse and buggy? Like, no, I'm good there. But when we grew up, it was all automotive accidents. We all sat in driver's ed class and we were told that motor vehicles are the number 1 cause of death of kids and teens, right? Not anymore. It's guns. So if you look at this chart and you're a parent, this should concern you, right? And again, as I keep telling a lot of my clinician friends, if you're empirically driven and you follow the data and you're a supporter of science, this should cause you to motivate and manifest some sort of action. Oops, sorry. So not only is it a generational issue for kids, but it's also a social inequity. It's also a social justice issue. Black teens are 18 times more likely to be killed or injured by firearms than white kids. So when we think about, everything that we're seeing in the news lately about DEI, about going down that path and not investing in those kinds of programs to really reveal the data that already exists. This is a number that should really make people in lawmaking circles, in state houses around the nation, sit up and take notice. But as I mentioned, it is an issue fraught with misinformation, with emotion, with history, with the Constitution. So trying to develop a campaign which tackles this head on, doesn't alienate red or blue, is a tricky task. But it's an important one, as the data shows. And the minute you try and raise your hand and say, hey, this is a problem, we should do something about it, everybody comes out of the woodwork, not least of which is the NRA. Right? So the moment the American Hospital Association came out and said something like this is an issue that we should really be tackling and paying attention to, the NRA comes out and puts out a statement saying, hey, physicians, doctors, leaders, stay in your lane. Well, for people who care about other people, and a lot of us got into this industry because we care about the outcomes, we care about other people, that didn't set well. And so their little post here generated 21,000 responses, 99% of which were saying, hey, this is my lane, come down and sit in my ED for a day and watch. In addition to being a empirically oriented healthcare issue, in addition to being an issue about social justice, it's also an economic issue. So in Maryland alone, this information comes from the Johns Hopkins Center for Gun Violence, which is right down the road from us, actually. The carnage that gun violence creates, and the death and the extra and the uncompensated care and all of the rest of it, lack of productivity or loss of productivity, costs every Marylander $1,500 a year. So it's our goal to really highlight this economic cost and divorce the issue of violence created by guns from the Second Amendment and guns themselves. So at LifeBridge Health, we have a history, as I mentioned before, both as part of our mission, our CEO being part of, or having come from population health, and we have a unique organization called the Center for Hope, which really deals with trauma, post-trauma care, and breaking that cycle of violence. We have invested pretty heavily in violence intervention. So let's say somebody goes into an ED, they get shot. We send in violence interrupters to talk to that individual, to talk to that family, to prevent recurring violence. We also have violence interrupters in some of our toughest neighborhoods in Baltimore, people who generally have been incarcerated themselves and who walk the streets, who know the streets, have that trust, have that credibility, and say, friend, there's another way. This leads to a life of incarceration, lack of economic opportunity, you name it. I know because I've been there. So I show this chart to legislators, and I say in an era of budget cuts, and this is just reduction in gun violence admissions to one hospital in our system in a relatively rough area over the course of several years through that violence interruption campaign. We've seen a 52% decrease over the course of 18 months, 2 years. So our message to legislators is, it works. You're facing budget cuts. You're facing needs in education. We understand. We are the best bet you're going to have. So to drive and put all of those messages, all those pieces of data into a campaign that resonates, we really wanted to make sure that we broke through. We wanted to take people by the scruff of the neck and say, listen, this is important. We're not, a gun fanatic. We're not a bleeding heart liberal. We're right down the middle. We want you to pay attention to the real facts and circumstances around this issue. Pay attention because it matters for X number of reasons. Pay attention and care. So we're gonna roll three. Let me set it up. This is a 3-minute video, long form video we shot over the course of a couple weeks. And we were very intentional about, as I mentioned earlier, about it being youth oriented, about the story living on its own. And then we took this and we've chopped it up into 15s and 30s, which we went really heavy with at the end of December and really up to today, and then I'll get into the strategy behind that.
Coming from nothing, try to see tomorrow. People feeling forced to steal because they can't ask to borrow. We come from families where pops never stayed around. Grew up on playgrounds with killer spray rounds. Complexes with regular SWAT takedowns. Streets covered in blood with cops who barely make rounds. That's why I write lines. Automatic circulate the pipeline. Lyricism that fight crime. Follow the right signs. How can a mother watching bullets rain, watching sunshine? Most of us taught to shoot, to steal, run from one time. A life in prison only take one crime, not one dime as we drop it. This the mentality needs stopping. It don't start at the home, it start in the street. Systemic redlining on which side gon' eat. If you had to shoot and steal just to get you next meal, you probably will. That's how the people where I'm from feel. All we know is what we know, they done fed us appeal. But when it comes to bullets on our block, we must appeal. They make us pick a side, no one to confide. When we young, they tell us we could be whatever, but they lied. Put them down and get up, put them down and get up. This is motivated for the people that been fed up. Put them down and get up, put them down and get up. This is motivated for the people that never let up. Put them down and get up, put them down and get up. This is motivated for the people that been fed up. Put them down and get up, put them down and get up. This is motivated for the people that never let up. People killing over sex, drugs, money, women, and pride. This doesn't stop with the pipeline. It starts with the right time to open up these young minds and system. Calling community politicians to take people from beneath and put them in higher positions. This is your job to keep more alive. That's why I put the gat down and never glorify things that leave most families mortified. It starts at the bottom. Change the young man's mind and you got him. Don't just lock him up after you caught him. Go and teach him to fish. If you won't do it, I'ma do it. I'ma reach him with this. I've been there. I seen drugs in the crib. Robbers and killers. Cook crack at 12 years old. All the bullshit they instill us. Feel like all you know is all you got, but it's not. You are so much more. Selling someone else's dope for the shore with a promise that you'll never be poor. Nothing but lies, homie. Put the gun down and rise, homie. Put them down and get up. Put them down and get up. This is motivated for the people that been fed up. Put them down and get up. Put them down and get up. This is motivated for the people that never let up. Put them down and get up. Put them down and get up. This is motivated for the people that been fed up. Put them down and get up. Put them down and get up. This is motivated for the people that never let up. If you seen the shit I did when I was young, you wouldn't know me. What I'm saying is ain't no one perfect. System is crooked, that's why you work it. Sell a key and buy a house, chop a brick and get a grip, man. That shit, it make me sick. It's like a blind man I'm trying to teach. But you better learn the language if you're trying to reach. Too many people on the news, they just trying to preach, but they don't know about what go down, homie. Put the gun down, homie. Put them down and get up, put them down and get up. This is motivated for the people that been fed up. Put them down and get up, put them down and get up. This is motivated for the people that never let up. Put them down and get up, put them down and get up. This is motivated for the people that been fed up.
So again, thanks to our agencies. Thank you. So again, thank you to our agency, Strawberry Frog, and a number of other partners who worked on that. But again, it's a long film. So what are your channels? What are your tactics? As I mentioned, we cut it up into 30 and 15s. We had a regional Super Bowl ad. I say regional because anytime I say Super Bowl, like the budget hawks come out of the woodwork. But it's been very, very effective. We've had lots and lots of press, as you'll see in a second. But the key elements here are it's story-driven. When I came to healthcare, my agreement with our CEO was, I'm not going to do old people riding a bike across a little bridge. I'm not doing that. If you want me, we're going to do stuff like this. If you don't want to do stuff like that and take those risks, because that's a very calculated risk, you need to pick somebody else. So kudos to him because he's been my partner in a lot of these things. He said, Brian, I've taken a lot of flyers with you, but they've all worked. So at least up to now. We'll see about tomorrow. But it's story driven. it's emotional, and everybody who sees it, I think, really comes away with that kind of visceral feeling, especially at the end where you see the teen buying the gun. It's visually distinct. It was made very intentionally to look like a short cinematic film. The memorable audio was a key piece. So the rapper, I'll go to the next slide here. The rapper is a guy by the name of Logic. He's a Maryland native. He has 6.5 million or 6.6 million Instagram followers, which is another key component of this campaign. So I can create strong creative and a great narrative, but we need people to see it. And I don't have that kind of media money, right? Most hospital systems operating on 2, 3, 4, 5% margins don't. So we wanted to leverage both his creative excellence, his story being a Marylander, but also his heart for the topics. He's been affected by gun violence, and his social footprint. So he was the one who wrote the ad, came up with the music. We worked with the Baltimore Children's Choir, which is an all African-American choir down in Baltimore City, who you heard in the background vocals. And it came out, I think, beautifully. He's also been very active in helping us spread the word of Stop the Iron Pipeline throughout his social media footprint. I'm going to play just one post he did about a month back.
What's up, y'all? It's Logic here, and I just wanted to announce that I've created this song for Stopping the Pipeline, obviously, which is about gun trafficking in the D.C., Maryland, Virginia area, primarily through Baltimore. It's really important to me because I myself have been around gun violence and gang activity and crazy stuff growing up, and I really feel that no kid should have to go through with that. So I wrote this song about just that, to spread awareness, and they actually paired it with this incredible music video. I would not call it a music video. It's a short film, and it's a beautiful film. It's really incredible. And it really just kind of depicts what goes on and how guns run in and out of the iron pipeline. I've also signed a petition at stoptheironpipeline.org, which I urge all of you guys to go sign. You know what I mean? It's really nothing political or crazy. You know me, I'm not really with that. This is just straight up doing the best that we can to keep guns out of kids' hands and give them, a better option. I wish I had this awareness when I was a kid. And I hope you support. So thank you guys so much.
So he and then another collaborator, Odyssey, who's down there on the right, have done a lot of work together to kind of spread the message of the iron pipeline, spread traffic, and make sure it's going to stoptheironpipeline.org. And that's the other part of our campaign, which I'm very proud about.
What's up, y'all? It's Logic here.
I'm going to skip that for a second. So a lot of what we've done, and the whole call to action for this campaign, the whole reason for being, is to drive awareness of the issue, number one. But awareness in and of itself doesn't do anything. It's creating pressure. We're looking to create pressure both at the federal and the state level. So we did, obviously, the trucks and the billboards. I got a frantic call from our VP of Legislative Affairs one day who said, "Do you know there's a truck out in front of the Annapolis State Capitol?" I said, "Yeah." And she goes, "Is that a problem?" I said, "No, it's my truck." So I learned from that to give her a heads up before she has a panic attack next time. But we've gotten a ton of pickup around the campaign itself. We've driven 3,100 signatures, and to get people to go and sign a petition and then email the governor and the attorney general is not a small feat. But we've had 3,100 people do that. We're hoping for more. And this is really the second phase of our campaign, which we're in now. So the first part was mass media, as I mentioned. The second part is leveraging Logic, leveraging Odyssey and their social media footprint, and getting their engagement, both nationwide and in the Delmarva area, to really engage and go to the pipeline and create that pressure. And it's working. So over the last 3 weeks, I've been in Annapolis along with my executive director for the Center for Hope, who I mentioned earlier, testifying about the impact that gun violence has on Maryland, the social impact, the downstream impact that we as a hospital system need to get compensated for, as well as the economic impact. And this is really critical at a time for pretty significant budget cuts in the state. And I actually had the state senator, this is some additional media that we've had. I had the state senator sponsor a bill. He wasn't aware of the criticality of the issue, but he sponsored a bill to make gun trafficking into the state, which a felony, which it wasn't before, which is mind-blowing to me. But he turned to me and he said, the marketing, the message is really compelling, and that's what caused me to write the bill. So it's very gratifying when we think about marketers, we think about the impact we have in people's lives. As a marketer, I want to have as much impact with as many people as possible, and this is a fantastic way to give me and my team the opportunity to do that. We've had great pickup both locally with the Baltimore Banner, the local NBC station, CBS, and a number of others, and some of it's cascaded nationally. Interviewed by NPR both regionally and nationally around the issue to raise awareness. This is the microsite. I encourage you to go take a look at it. What it does is it takes people, it educates them at the top. It's pretty simple. It takes you down to the bottom, and it gives you 3 ways to activate. Sign the petition, which is the 3100 number I showed you earlier, message the Attorney General, and then share your story. We want user-generated content. We want people to tell us their own story, their own how gun violence has impacted them and their family and their life. We've gotten a lot of great comments on that. We had a gentleman who actually knew my digital director of media, and he had lost 3 sons to gun violence in the space of 2 years. And so if you go to the site, he shares his story. But as I mentioned, my pitch to legislators, both nationally and federally, along with our CEO, is an era of budget cuts. Reducing gun violence is not only a wonderful thing to do for your citizenry, but it's a wise investment as well. For every dollar that we spend preventing gun violence, we save $600 on the back end. These are some of the bills that we're advocating for. I mentioned SB 443 about classifying firearms as a felony. 444 is about gun locks. And 397 is an excise tax on the sale of firearms and ammunition to kind of help compensate organizations like ours for the downstream care, the uncompensated care that we have. And again, I would encourage all of you to go to stoptheironpipeline.org or hashtag and sign the petition. So I really appreciate your time. Thank you so much.
All right, thank you, Brian. What questions do we have from the crowd?
Have you measured the impact on the reduction of gun violence or gun trafficking in the pipeline based on the campaign?
No, we haven't, not yet. It's a very good question. Part of that answer comes from interdiction, right? So one of our other partners, and it's relatively new in the last 60 days, is the ATF. So we're working with them. They're giving us data to be able to start tracking that impact. The other element that we're also working with the Attorney General on, and you've seen this in other states, New York did this for opium. The city of Baltimore just has done this for Glock, the manufacturer of guns. We want to go after some of those retailers, and the ATF knows exactly who the retailers are, where most of the stolen guns in some of the southern states come from, and it gets shipped up the iron pipeline. So the ATF has that list. Our Attorney General has that list. And we're working with them to try and figure out a legal remedy to go and target those retailers who are really abusing the system and creating a lot of the destruction that comes up north. Any other questions?
Getting my steps in.
Thanks, Brian. I know working for a health system, this is pretty powerful. My question is, how did you get your physicians on board with this campaign? And then, so they felt like they weren't being political, but also making sure they had patient care at the center. So we'd love to hear that feedback.
Yeah, no, that's a great question. So what I've learned coming into healthcare is that physicians are people too, right? So the minute we launched this campaign, my boss, got a bunch of texts and emails from both sides of the aisle around guns, gun violence. The ED docs were great. This is what we need to do. Tell me how I can help. Some of the other docs, more rural-oriented docs, we have rural hospitals as well, were like, guns don't kill people, people kill people, that kind of thing. So it's been, and both sides have valid points. And so we try and talk to them empirically about this is the problem. The data doesn't lie. We're not trying to say one side or the other is bad. We're trying to let you know that this is a problem that shouldn't exist. Nobody can really get behind a bad gun, meaning stolen, in the hands of a bad person, somebody who couldn't buy one legally, right? That's a very difficult argument to kind of be pro for. The physicians are, by and large, really behind the effort because they think it's about time that somebody did this. I'd say the pushback is somewhat muted, and it comes from darker corners of the internet and stuff like that. I post and I try and be rational about it, and then my team says, "You don't want people showing up at your front doors," and they take it down and they put it back up. So it's a fun exercise, but it's a great question, and I personally think that it's a very straightforward argument, but it's a very, very emotional issue for a lot of people.
All right. Thank you, Brian. Really appreciate it.
Thanks, everybody.